My dear great friends who have assembled today to listen to this unique program. And I call it very contemporary program because beginning October we have all the festivals. It has been said in the India, uh, we are in a country which is a country of celebration. And we celebrate life, and the life celebration is manifest in India's festivals. From October till December, we have many festivals, and we are discussing about festivals and diabetes. And before I go further, it may great pleasure and honor to invite Dr. Supratik Bhattacharya, one of the very eminent endocrinologists of the country. Supratik, very good morning and very hearty welcome. Supratik has a very, very important and very checkered career. He left India after plus 10 and his entire schooling, medical college schooling, medical school, everything he finished in the United Kingdom, which is the Makkah of diabetes, which is a great country for clinical medicine. After finishing his medical school, he went over to do the specialized endocrine diabetes, and today he is one of the most prominent and one of the youngest endocrinologists of the country, who has his own SKM Diabetes Endocrine Center, of which he is the director. He is also practicing in the Apollo Sugar Clinic and the famous Amri Hospital. And his focus has been on the endocrinology and diabetes, apart from PCOS and other things. He has published over 50 papers. And he is one of the most eminent, most promising clinician, researcher, and I must tell you, a teacher for all of us in these times of public speaking, in the time of talking to the healthcare providers. Supratik, healthcare providers also here. Supratik, I would just like to mention before I hand it over to you that India is a country of celebration. Come October, we start with Dashara. We have Chhat Puja, we have Diwali, we have Holi, and we have the Ramadan, we have the Idul Fitr, and we have and December we finish with Christmas. Before October till January also we have a lot of festivals. I have not time to describe them, but I was telling that this talk is very contemporary. Am I correct? Because this is the time of Diwali, and diabetes has become a very common disease and affecting about, if I may allowed to say, in the ISM India latest data, in some parts of the country, one in 5%, one in 4%, 25% in some parts of the country. So it is very important for all of us to know how do we manage the diabetes during festivals, which is our celebration, which is we carry sweet memories, and it gives us a longer jest for life, a longer feeling of closeness with this. Supratik, over to you for your masterly presentation. Then we'll start a small discussion. Over to you, Supratik. All is yours.
Thank you so much, Professor Das, for these kind words of introduction. And Dr. Das has been a mentor. He's been a very good friend of mine, and he is a leader in what he does. And we are the followers. So I'm very, very happy to be at the same platform where he is today. And I think, as he just mentioned, with the Diwali coming up, I think the topic today is very, very relevant. So we just had our Durga Puja, which is one of the biggest festivals of Bengal, and obviously that will the festivities go on with the Diwali coming up, then Chhat Puja, and then followed by and it goes all the way up to the Christmas, as we have been talking about. So if we can have our slides, please. So diabetes and festivals. This is going to be the topic for today. And we know that there are ample number of festivals that are there between October and December, and Professor Das has been mentioning all of those. And there are, I think, two kinds of diet that goes on during these festivities. One is, we know that as a nation we have been heavily dependent on carbohydrates. So the Indian plate size is almost two-thirds consisting of carbohydrates, and that remains a concern because, as compared to the Western counterpart, the representation of carbohydrates on the plate is much more. And comes the festivities, I think there's a lot of binging on the carbohydrates as well. The second part that I want to concentrate is that during these festivities, many times people go fasting for prolonged durations of time. And when we talk about fasting, it's varied, like sometimes it's like you don't even drink water and then you go fasting the whole day, or it could be just simple things like fruits and juices. So there are various kinds of fasting, but overall, like we know that there is a lot of consumption of sweets and fat-rich fried foods during these festivities. On the other hand, during some of these festivals, as we had said, a lot of erratic eating pattern is observed, and like we said, that there is fasting, and then suddenly when you break the fast, there's a lot of feasting. So in the end, the person with diabetes, does the celebration of festival comes at the price of good health, is what we want to understand from the next few minutes that we talk about. Now, the management of diabetes during these phases are very, very important. And we want to understand, how do you get to know whether your blood sugar is running too low or too high? So in general, like if you're feeling a heavy head, if you have palpitations in your chest, if you're feeling a bit anxious, tremors in your hands and feet, fast pulse, so these are the kind of indications that your sugar might be running a little low. And that's an indication, especially if you're fasting, to check your blood sugar, and the sugar, if it runs very low, you might consider breaking your fast and having something which is rich in carbohydrate. On the other hand, many a times what happens is, if your blood sugar goes very high, then again, you need to use the toilet more frequently. You have to get up in the middle of the night and go and use the loo. Uh, and many a times you come with, genital tract infections, a headache, some kind of lethargy, fatigue, etc. And in extreme circumstances, there is a lot of dehydration, which warrants a person to be getting admitted to the hospital and requiring emergency treatment with insulin. So challenges in diabetes management has been that hypoglycemia, dehydration, diabetic ketoacidosis. So this is one of the conditions that are associated with uncontrolled diabetes, and also microvascular and macrovascular problems. Again, some things that we see during. So if a person is having a bad glycemic legacy because of uncontrolled diabetes, all of these might come up. So taking insulin and other OADs without any dose adjustments during the fasting period increase the risk of complications. So there are certain classes of agents which, if not used very judiciously, might lead on to hypoglycemia. And we need to sit and educate the patient how to use those molecules, if at all, during the fasting period. And of course, if there is an option to replace them with something which is safer to be used during the fasting, I think that should be the option that we should be looking into. So during fasting, alterations of physical and mental health, especially elder and comorbid patients with diabetes, places them at great risk of complications. So anybody who is a frail individual, somebody who is elderly, we need to be very cautious that they do not have any episodes of hypoglycemia, because that might lead to falls and increased hospitalization. Also, due to regular food habits, some patients may miss the usual medication dose, and poor monitoring of diabetes complications, blood sugar, specifically in the rural areas, does possess a significant risk. So what are the do's and don'ts? So it's ideal if you can break your meal into smaller portions. So rather than binge eating just one or two meals, if you break up that meal into smaller parts, it's highly recommended that you do not go empty stomach for more than 3 hours if you're on diabetic medications, which can predispose you to hypoglycemia. Those who are insulin users, we highly recommend that prolonged fasting is not recommended for them. And as we had said, break it up into smaller portions and have meals regularly. In between the meals, you can have something which is not simple carbohydrates. For example, I recommend apples, guavas, which are known to be complex carbohydrates, which will sustain your blood sugar. Avoid sugary drinks and replace them with something like water, sugar-free lime juice, etc., coconut water. Bakery food items like biscuits and cakes are to be taken in moderation, if not avoided completely. We know that festivities like Christmas is all about pastries, and you can't really avoid them, but do have it in moderation. If you are a diabetic individual, you can opt for healthy snacking like nuts, olives, pieces of fruits, replace traditional sweets, avoid white rice, consume brown rice. So basically, we're looking at the glycemic index of the meals and try and replace those which are of high glycemic index with lower glycemic index food. Avoid excessive indulgence in alcohol, as it contains large quantity of sugar. So it can happen. So if you are binge drinking on alcohol, that can predispose you to hypoglycemia even, and sometimes prolonged or chronic drinking of alcohol might be detrimental. So you need to cut back or moderate your doses of alcohol. So management, normal levels of physical activity may be maintained. However, excessive physical activity may lead to high risks of hypoglycemia and should be avoided. It's highly recommended that before you start any physical activity, you should be doing a little bit of snacking. So whether you're thinking of doing some treadmills, cross trainers, or any kind of cardio activities, or even some amount of brisk walking, it's highly recommended that you don't go empty stomach, but have a little bit of a snack which consists of carbohydrates. Glucose monitoring is very, very important. So test your blood glucose levels at regular intervals. And if you're undergoing prolonged fasting, for example, during Ramadan, you need to monitor your blood sugar. And if it runs very, very low, in that scenario, you might have to consider breaking your fast. In blood glucose levels is less than 70 milligrams or more than 300 milligrams per deciliter. This is one of the considerations to break your fast. And after breaking the fast for hypoglycemia, you need to consume some amount of fast-acting carbohydrates, followed by those kind of carbohydrates which are complex in nature, which can sustain the blood sugar levels. So lifestyle modifications, attend pre-fasting counseling and learn the warning symptoms of hyper as well as hypoglycemia. As we mentioned, we need to sit with the patient and talk to them regarding the medications that can cause hypoglycemia. And frequently we change the timings of the medications. So there are certain classes of medications like sulfonylurea, and which can predispose a person if they're on prolonged fasting, predispose them to hypoglycemia. And frequently what we do is, say for example, if they're using sulfonylurea in the morning, we change it over to evening with iftar when they're breaking their fast. So we need to sort of sit and understand the pattern. Also, we need to monitor the blood sugar before they go fasting so that we understand that they are stable on their diabetic medications. And if feasible, try and change those medications which can predispose them to hypoglycemia, and sort of switch them to something which is known to be safe. So strict adherence to diabetic diet is needed. You have to ensure that the person is not forgetting to take their medications, and also not to overeat when the fast is broken. So many times when the fast is broken, there is a tendency to binge eat. So you need to remember that that's not very healthy, and so you need to sort of break it up, and then minimize eating something which is very which is very high in fat content. So simple things like samosa, these kind of things are to be avoided. Try and having complex carbohydrates like fruits, like apples, as we said, while you're breaking the fast, and also ensure that there is some amount of fast acting or simple carbohydrates in the meal as well. So record weight daily and inform the doctor of gains or loss of more than 2 kilos if that happens over a very short duration of time. If a complication occurs, break the fast immediately, as we said, and seek help. A patient's family should be aware of potential problems and alert their doctors immediately. And serving of meal supplements may be added to the pre-fast meals. So there are many diabetes-specific nutritional supplements which can be used to supplement your diet or as a meal replacement, and that sustains the blood sugar levels and ensures that there is no hypoglycemia. So that kind of diabetes specific nutrition supplements can be considered during the fasting as well. So, treatment strategies for diabetic patients, early initiation of combination therapy. We know that from Dr. Kamlesh Kunti's study that if you're away from your target HbA1c for more than 1.5%, and from the diagnosis of diabetes, if you do not reach the target HbA1c within the very first year of life, then you significantly increase the chances of a future cardiovascular event. So we have to be very, very aggressive in terms of getting the glycemia to the control. And there are certain medications which are novel in their approach. And if you talk about the defransosominous octave, incretin-based therapy along with the SGLT2 inhibitor probably addresses the basic pathophysiology the best and covers a more number of ominous octave as compared to the other OHAs. And these are the kind of medications that needs to be considered while we are treating diabetes, because it addresses the basic pathophysiology and decreases both micro as well as macrovascular events. So be a little judicious with the SGLT2 inhibitors during the fasting if you're not taking water throughout the day, because SGLT2 inhibitors warrants you to be hydrated properly. You might change the timing of the medication so you can use the SGLT2 inhibitors while they're breaking the fast. So this is the combination that we are talking about. And as we had said, SGLT2 inhibitor is very unique in the terms that it causes glycosuria as well as natriuresis and reduces glucotoxicity, reduces body weight and systolic blood pressure. So many pleiotropic benefits that come with it. The DPP4 inhibitor, on the other hand, boosts the endogenous GLP-1 levels and also is weight neutral and both of them reduces hypoglycemia. So this is probably the safest combination to consider in a person who is probably going to have a prolonged period of fasting, because it addresses all the aspects in terms of not causing hypoglycemia, achieving the glycemic targets the best, and also in terms of addressing the basic pathophysiology and having many pleiotropic benefits that come with it, and is in effect a cost effective solution. So for stabilization, SGLT2 DPP4 should be initiated at least a month in advance, and the patient should be followed up to see that the blood sugar levels are very stable before the fasting begins. And also, we need to understand that after the initiation, if the person is having a background of cardiovascular or renal problems, this is probably one of the safer options to have. And also increasing fluid intake. As we said, the person needs to be hydrated whenever there is a SGLT2 inhibitor on board or a GLP-1 receptor on board, because this warrants the person to be hydrated well. And also, SGLT2 DPP4 does not require any treatment modifications during fasting. Only thing is, you might sit with the patient and decide on the timing of this particular medication. So other therapeutic considerations and recommendations, and this is probably one of the last one slides that I have. I'm just about to conclude. So individuals with type 2 diabetes on 3 or more anti-diabetic agents who fast should receive counseling, comprehensive advice on diet, lifestyle, and drug modifications. I was part of the Dire Ramadan study where I showed that even extended release glycoside can be used safely during prolonged periods of fasting like Ramadan. It's just that you need to educate the person well and how to place the medication and the timing of this medication as well. So individuals on 3 or more drugs, especially those on both insulin and sulfonylurea, can cause hypoglycemia theoretically. So either you need to cut back on the dose of insulin or the sulfonylurea, or change the timing and educate the person. And approximate 25 to 50% reduction in the dose of insulin is advised, depending on the subsequent risk score after risk stratification, and a reduction in the dose of sulfonylurea is also advocated. And sometimes we can replace that with safer alternatives as well. So newer technologies, including continuous glucose monitoring, is sometimes very helpful because we get to know, and many the real-time ones where you have a reader, you get to know your blood sugar level without pricking your finger, which probably is a concern for some religion to prick yourself during the period of fasting, and this could be very helpful as well. And this helps in reducing hypoglycemia because you can intervene whenever the blood sugar level is going down because you get to know the trends. So I think that is my last slide, and I'd love
Pratik,
to have.
thank you very much. I think it has been a very fabulous presentation, all inclusive and very clear. So I have no desire to summarize your talk because it has been very clear, crystal clear. I'll just start my discussion where you ended. As you rightly said, if you want to discuss two drugs which do not produce hypoglycemia, DPP4 and SGLT2 figure prominently. And a combination of both is absolutely important to know that they do not produce hypoglycemia normally. And also, as you rightly pointed out, that dehydration must be avoided at any cost. I will also like to add in the same vein that you said that even though we have sulfonylureas like glibenclamide, which can give us a very prolonged hypoglycemia, 7 days, 8 days, even of discontinuing, the later sulfonylureas you cited, one of them glyclazide, MR, longer release, that we have classified, Sripatik, as you know, as the modern issues, and they are little better than the older sulfonylureas, glimepiride and metformin combination, or even glyclazide MR and metformin combination do have that. And glipizide has a short-acting sulfonylurea. Beautifully said. Now, my first question to you that in general, Supratik, we have got about 10 minutes. We have got about 10 questions. So we will take about half a minute for each question. What's your advice to the diabetics regarding the festivals? I'll start by saying I always tell my patients you cannot stop your medication or exercise. So, like that, what are the other simple advice you give to your diabetics during the festival season? The other thing I say, as you rightly said, that it is unrealistic to tell you to keep away from the festivities. Food, life is a celebration. Our life is full. So we advise them, but in moderation. So, other advice, what you give to the people of the cough.
No, so I think this is the most practical question that you have asked. I think it's very, very relevant. So I say that, like there's nothing that you cannot do. So that's the first
Absolutely.
opening sentence for me. Only thing is you are a mature individual, so you have to do everything in moderation. So ensure that you're counting your calories. Ensure that, you're not binging on carbohydrates too much, and ensure that you're not going empty stomach for very prolonged periods of time that can predispose you to hypoglycemia. So get the basics right and enjoy the festivities.
Fantastic. I think that's the correct answer. And as you say that, we always say avoid red meat during the festivities. You can take fish, but you can take red meat also in moderation. Rather, white meat in moderation will be. We said that, as you said in your talk, that avoid the oily samosas and pakoras. Instead of the take some fruits, or if you do not like fruits, take some nuts. Nuts are not, they're taken in small quantity and do that. I also tell them, if it is possible, use one of the artificial sweeteners, stevia or something. And instead of, I have a liking that jaggery. Studies also have shown maybe a bit better. I don't say too much better, maybe a little better than that. And what's your advice? I think you touched upon that point. The plate size matters. Am I correct? The size matters. So I always tell them, take your sweets or your food in a festival in a smaller plate that gives you a fullness, that gives you a completeness. At the same time, gives you a richness and the adequateness of the food. What do you think about it?
Yeah, so you're absolutely right, sir. And the way I say it, like some people have a sweet palate, and I say, why don't you take a bite, keep that sweet back, and then you come back and take a bite again, and try and finish that sweet over a period of time. So that works. That caters to your need, like so that you don't feel that urge to have the sweet, but at the same time you're relishing what you enjoy.
I think there's a very important thing that you said. I would like you to repeat for our audience. The features that the patient, not person, the persons with diabetes should be aware, and very brief, just three to four of the that sugar is coming down. You said that, but out of that, two or three, which is very important, to just think sugar is coming down. As you said for the hyperglycemia, you said frequent urination, feeling under the weather, feeling fatigued and sleepy. That, I mean, very simple things. Keeping having a headache. So, what do you think the three or four very important symptoms of impending hypo?
Yeah, so I think the most frequent thing is, like you have a heavy head,
Okay.
kind of a sensation. sometimes there's palpitation in your chest and anxiety kind of feature. You might have some tremors in your hands and feet. So you might have increased sweating. So these are the kind of things that you have to look out for.
Last time also
Then,
you told about the blurring of vision, Supratik.
yeah.
I think a little bit of blurring also makes you aware the sugar might be coming down. Fantastic. I think that's the thing which people should carry forward. The other thing that I would like to have you speak to our people, to our audience about, is the thing regarding, as you said, that in Navaratri time there is also a fasting, there is also a feasting, and there is also a lot of physical activity, as you know, dandiya dance, whatever dance, dancing and all that. So, what's your advice when you have given advice for the fasting, you have given advice for the hyperglycemic condition when they're feasting, when it's combined and also a lot of physical activity? What do you do advise during Navaratri?
Yes. So I think we covered the fasting and the feasting part, but when it comes to the physical activities, as I said, you want to ensure that any kind of physical activity should be just preceded by some amount of snacking, which should include some amount of carbohydrates. Because during the any physical activity, the sugar that is there in your blood goes back into your muscles and liver, and so you might have a tendency to feel hypoglycemic if you do not do the snacking prior to your exercise. So ensure that you're snacking.
Fantastic. Now, people also have said that if it is possible, you try to mix the foods which are rapidly absorbed and the foods take a longer time. Like you can take a smashed potato, at the same time take something very high fiber carbohydrate, which take a longer time. Do you believe in that? That there's a type of dosha called kuttuka dosha. They break the dosha into multiple types, but this is not ordinary butter dosha. It has something which makes dosha absorb over a longer time. Do you believe in that? That sometimes the mixing of the food can be also beneficial?
Yes, I mean, so it's always recommended that you have a source where you have an immediate sort of or fast-acting
Yeah,
carbohydrate, and then once your blood sugar levels are up to the levels that you expect, you want to sustain that. So, and that is exactly done by the complex carbohydrates that comes from
absolutely.
like apples.
Today is one of the concept in the nutrition. Don't consider the nutritional value in isolation. Rice is different. Rice with dal is different. The vegetable fried rice with a dal tadka or something which is well mixed, the nutrition value is much better than taking alone based. I think we touched upon that point very well, very well. Now you see, there is another thing which is very important, that if you feel the sugar is going very high, it rarely occurs, Supratik. I'm very sure. Yeah, I have surely one case because of the uh, non-session drinking and very rich food. Somebody can sometimes go into ketosis. So, what will be your advice to see that the patient is probably having impending ketosis and all that? I mean, I don't know whether I agree with it or not. I have seen people having a different type of breathing, little
Yeah,
shallow
so
breathing.
you get a fruity or the odor when you
It-
see, and so this is
Exactly.
typical, you know. So
Yeah,
so I think the person in general will be losing a lot of water, you know. So a person gets dehydrated. So especially type one diabetic
that is
individuals.
very important. I think, Supratik, dry mouth. Dry mouth has to be one of the features. It can be both, but one of the most important features of hyperglycemia is feeling sleepy, feeling under the weather. When I tell you one thing, long before the necessity Wikipedia came, Supratik, while you was a student there, it was published in the BMJ that euglycemia gives you a great sense of well-being. I'll repeat again, euglycemia gives sense of well-being. If somebody has severe hyperglycemia, that well-being is lost. So I think that's a great message to carry, that the well-being is lost. So you're feeling under the weather, feeling sleepy, feeling fatigued, feeling your mentation is slow. What do you think about it?
Yeah, I mean, so these are the pointers that something is not right. So you need to check your blood sugar and then act appropriately. So if you see that it's running very low, then you need to, if you're on insulin, then you need to cut back on the insulin. If it's very, very high, as we were talking about in case of a DKA, in that scenario, you want to ensure that you have not missed your insulin dose. Or if you're on a pump, you want to ensure that there's no blockage. And then,
Yeah.
so these
Great,
are the
great
basic
guidance.
things that
That's
you
great
need
message.
to
You remember, Supratik, long back in Australia, a lot of the pump failure went into a
Yeah.
decay because there's a block in not flowing. Absolutely. I think, Supratik, I cannot appreciate talk more. At last 2 minutes, I've got 4 questions to ask, but very important questions. You may find little odd. Many people increase the insulin doses while their diet during festival, say during festival, is very high, very rich, a lot of sweets. You approve, you disapprove. This is not a medical question. Your practice points.
Yeah, I mean, so we do sort of empower the patients to
Exactly.
understand, to we let them count their carbs and adjust their insulin doses
Absolutely.
accordingly. I think that is very much important. So,
Two things, as you rightly said. I don't say intelligent, a patient who knows, and he can self-adjust. It is always welcome at the same time to err on the side of hyper than hyper. Tell them that don't take too much insulin. What about
good.
the orals? Do you think the orals can be adjusted to the food?
So I don't highly recommend adjusting oral medications unless
Right.
it's like a short-acting thing like
Yeah,
a
yeah,
repliclinide where you are not having a
right.
meal and you miss the repliclinide, or a AGI where you can drop out on an
You
AGI.
said you took the word out of my mouth. Supratik, one of the tricks of the trade before cataract surgery, sugar is very high to give AGIs, to give Voglibos, to give, I mean, no, to acarbos, to bring it down. Voglibos you mostly use today. And also the tricks of the trade is to give a short acting issue sometimes if you're eating much and sugar is not getting control, maybe lipid, which is possibly a very short acting then. The last question that I want to ask you, Supratik, is the point very close to my heart, and I just wrote about it along with Dr. Krishna Sasadri. You rightly said that the first year diabetes control matters. And that paper in Journal of Diabetes Care from the Chicago School of Medicine by that professor is one of my highest appreciated paper. She showed, Supratik, in 34,000 patients, those were controlled the first year, H1C 6.5, maximum 7, had nil death and complications were much low. In contradistinction, but the first year control went hayward. There was early deaths. There are 14 deaths in the early time of 13-year follow-up, and the complications were very high. So your message today is very important. Early aggressive control, I call it first year control. And the other thing I look at it like this: you say somebody you control diabetes now, you get the benefit 10 years later. Well, 10 years of time is there. That doesn't impress him much. You tell him, no, you control your diabetes. Today I have diagnosed you. In the next year, I want to see the entire year 6.5. That makes a sense to him. That gives the impetus. I'm telling you psychological aspects of diabetes. Therefore, you rightly said early aggressive control matters, and you pointed out that the ominous octet, 7 out of the 8 can be addressed by a combination of DPP4 and SGLT2. And DPP4 itself stands out as a wonderful drug of non-hypoglycemic, non-weight gain. So before I close, it remains for me to thank you profusely, Supratik, for a very, very, what should I say, practical talk. Lot of clinical point, lot of practice points. It must have benefited our SCPs and people who attended this function. So our program is for 31 minutes. We have finished 31 minutes. It's my duty, very honored duty, Supratik, to again extend the thanks on behalf of everybody for your masterly talk and very, very perfect discussion. Thank
Thank you
you.
so much, sir. And once again, a big congratulations on your paper because that has profound implications, and the results that came out of it is quite profound. So hopefully, we'll take that into our clinical practice and be very proactive in terms of getting the glycemia to
I must
control as
admit, the idea came from Krishna Seshu. Krishna Sasadri gave me the first idea. Then I traced out the paper we wrote. Thank you.
well.
Thank you very much.
Thank you, sir. Thank you again, everyone. Bye bye.
Again, bye bye. See you, Supratik, somewhere quickly, and see your papers also. Thank you.
Thank you, sir, and happy Diwali.
Very happy Diwali to you and to entire Pratik and everybody present here. But happiest Diwali greetings to the large number of people who have joined.